Hello, and welcome to this short video that provides during pregnancy, birth, and postpartum, survivors often slip through the cracks. Healthcare providers may deliver excellent medical care, but may not be well informed on how past or current abuse may impact their patient's experience. Similarly, advocates may provide excellent survivor support, yet not have a lot of knowledge on how pregnancy, labor and delivery, and early parenting may be triggering or could be healing for a survivor. The intersection of reproduction and interpersonal violence is often overlooked because of widely held social beliefs that pregnancy and new parenthood is a protected or a sacred time. A lot of people assume this time is a break from abuse. But we know that pregnancy and violence occur together at a far higher rate than many people realize. Many survivors report that abuse started, became worse, or became physical for the first time during pregnancy. Interpersonal violence also increases the risk for unplanned pregnancies because of reproductive coercion. If you're a healthcare provider, the likelihood that your pregnant patient has or is experiencing domestic or sexual violence is actually a lot higher than you might realize. Pregnant survivors might be triggered in a variety of ways throughout pregnancy, labor and delivery, or early on in their parenting. Triggers can be internal, such as the loss of control over their body or changing feelings about their body. And there can also be external triggers, maybe from invasive medical procedures or even routine vaginal or cervical exams. Learning more about how trauma may manifest during the perinatal period is the first step to providing trauma-informed and patient-centered care. Penny Simpkin, a physical therapist, childbirth educator, and researcher, found that the difference between survivors experiencing pregnancy and birth as triggering or as powerfully healing lies in the support they receive from their caregivers during the process. Healthcare providers and advocates are in a unique position to support survivors of abuse to not only have a fulfilling birthing experience with positive outcomes, but may also foster profound healing. Learning more about basic dynamics of domestic and sexual violence can help provide a more survivor-centered and a trauma-informed care to patients who've experienced abuse throughout their life. This not only results in better outcomes for the pregnant person and their baby, but can also help providers think through ways to work with patients and help identify possible triggers and then come up with creative alternatives together. While this mini training provides just a few ways survivors might be triggered during routine procedures and interactions, we recommend accessing additional resources and more in-depth trainings that are included at the end of this video. Even survivors with healthy pregnancy, labors, and births without complications experience a lot of different procedures that involve invasive touch. Routine ultrasounds, cervical checks, and physical exams can be triggering for some survivors of sexual violence or childhood trauma. Think about whether or not there are ways these procedures can be limited. If they can't be, a more trauma-informed approach might be slowing down to explain the procedure and any physical sensations the survivor might experience. For example, pressure or discomfort in certain areas. Or making sure to always have explicit consent before any physical touch. While labor and delivery can be overwhelming for many different people, for survivors, the loss of control or decisions being made on their behalf can echo past experiences of powerless or feelings of victimization. Pain, discomfort, invasive procedures, and lack of control over the whole process can be especially problematic for someone who's experienced abuse. Even seemingly helpful advice, such as just relax and this will be over faster, or maybe let your body give into it and it won't hurt as bad, can remind survivors of things their abuser may have said to them. Common medical interventions like epidurals, IVs, or continuous fetal monitoring can be challenging for people with past trauma. They might remind folks of situations where they were harmed or had very little control. Providing detailed information about options and respecting the patient's preferences is essential. How can we provide a variety of options and work together to create the best experience possible for a survivor of sexual or domestic violence or childhood sexual abuse? Consider options like intermittent fetal monitoring, limiting cervical exams to only when necessary, or using mirrors, lighting, or modesty sheets creatively that can allow a birther to see what's happening and who's in the room during labor and delivery. These small changes might increase feelings of control and bodily autonomy and reduce re-victimization. Building relationships with local doulas and other birthing support professionals and collaborating with domestic and sexual violence advocates can help provide extra support survivors might need. Infant feeding can be a joyful bonding time between parents and their baby. But for a lot of survivors, infant demands to nurse, pain during latch or feeding, very normal playfulness at the nipple with older babies, feeling exposed while nursing, or maybe just a general lack of bodily autonomy might also be very triggering. Be mindful of these triggers while providing lactation support. Offer privacy while the patient is getting into position, and be mindful of modesty. Never engage in any kind of physical touch before clearly explaining what you're going to do, why you're going to do it, and then asking for direct consent. Because infant feeding generally centers the baby, we often forget that we're touching private or sensitive areas of a person's body, sometimes without consent. Even if the birthing person is the one that requests the support from a lactation professional, it's essential to obtain consent before each and every time physical touch is made. Providing trauma-informed care to pregnant, laboring and delivering, and parenting survivors might feel overwhelming. You might feel like your patient load is too heavy to afford the additional time, or that doing things differently conflicts with too many already established norms and policies at your clinic. Maybe it feels uncomfortable talking to patients about domestic or sexual violence, or perhaps there's a concern that you don't know enough about it and may unintentionally harm a survivor. These concerns are valid and totally normal, and they can be addressed by implementing just a few elements of trauma-informed care. Let's look at this in practice. Discomfort asking about abuse can be reduced by practicing universal education instead of or in addition to the routine screening questions typically asked. Providing every patient with resources and information about domestic and sexual violence, along with how prevalent it is during pregnancy, can help normalize that conversation. It doesn't require you to directly ask someone if they've experienced violence, and it also doesn't require your patient to disclose any personal experiences to you. Other examples that could be more easily implemented to shift into a more trauma-informed practice might include always knocking and introducing yourself when entering the room, regardless of how many times you've come in and out with the same patient. Take a moment to pause and explain each step, the why, the benefits, and the risks, so you and your patient can make informed decisions together, and become familiar and more comfortable with some more creative and alternative solutions to the way that we've always done things. Finally, it is always essential to obtain clear and direct consent before any kind of physical touch, even if it's a routine procedure. Remember, helping with a nursing latch or performing a cervical exam might be a routine part of your day that you've done hundreds of times, but it might be the first time for your patient. For a survivor of sexual abuse, it might feel very similar to other things that they've experienced. You can find more detailed information and resources on our maternal health webpage provided at the end of this video. By recognizing how prevalent domestic and sexual violence occur during pregnancy, Healthcare providers can offer more compassionate, trauma-informed care for survivors. You can improve outcomes for pregnant and birthing people and their babies. And you can help pregnant survivors feel safer, more supported, and more empowered. Thank you for taking the time to watch this short video on ways to support pregnant, laboring, and delivering and postpartum survivors. You can learn more about this and related topics at www.mcedsv.org. Click on the Maternal Health heading to access a wide variety of other recorded trainings, information on upcoming live trainings, and hundreds of other resources. This video was developed with support from a grant from the Michigan Department of Health and Human Services, Michigan Maternal Mortality Surveillance Program. The opinions, findings, and conclusions or recommendations expressed in this training are those of the Michigan Coalition to End Domestic and Sexual Violence and do not necessarily reflect the views of the U.S. Department of Justice or the Michigan Department of Health and Human Services.